Trying to describe the rich cultural diversity and history of Nogales, Arizona is like trying to describe a warm tapestry of colors and hues. In the 1690s, the Spanish established missions nearby. In 1821, Mexico ceded from Spain and the area became part of Mexico. In 1854, the Gadsden Purchase meant the region was turned over to the United States. By 1880, the Isaacson brothers joined others and founded Nogales by establishing a border trading post. 2 years later, in 1882, the railroad came to Nogales. The town was now on the map. Today, Nogales is Arizona's largest border town. When you live in a border community, you live with each foot planted firmly in two cultures. Hispanics and even non-Hispanics seem to switch effortlessly between two languages, dos idiomas. This has always been the type of community where neighbors watch out for each other, nos cuidamos. Nowhere is that more evident than with the establishment of the Mariposa Community Health Center a quarter of a century ago.
When I got here, I said, these people know what they're doing. They care about the people outside the door. That's the big thing. I am so proud of this organization. I brag about these people all the time because I travel a lot. And anytime we get talking about any kind of healthcare or medicine or anything, I start telling them about Mariposa, and there's just nothing like it.
The doors, las puertas de Mariposa, are open to everyone. While 32% of our funding comes from government grants to support community outreach and education efforts and care for the underserved, the majority of our funding comes from seeing patients who carry all types of major health insurance.
First of all, I'm a patient of Mariposa. I was a patient of Mariposa before I joined the board of directors. My wife's a patient. I have twin daughters. They're going to U of A. When they were born, that they were patients of the pediatrics department. So I'm very familiar with the good that this organization provides a community.
What has become one of the most innovative and respected community health centers in the nation had its humble beginnings in this small, rather ill-suited building in 1980. But our community health center has grown along with our community. There are now 17 medical providers in the specialties of family practice, pediatrics, internal medicine, obstetrics and gynecology, plus 4 dentists, 2 pharmacists, and a mental health therapist.
Regardless of who you are, regardless of your economic status or your ability to pay for quality health care, you're going to get treated with respect and with dignity, and very importantly, obviously, you're going to get provided with high quality health care also.
It's very important to be able to get good care for your children and for yourself when you need it without having to drive a long distance.
They don't just open the doors and provide health care. They are constantly updating. They are bringing in new programs. Our women's health program is a model for the country.
And so is the health center's telemedicine program.
And you can see at this point there's no redness, there's no swelling. Again,
the partnership is between the Mariposa Community Health Center and the University of Arizona Medical Center. A doctor in Nogales can consult with a specialist in Tucson and do it live through the use of television monitors.
And you can see at this point there's no redness.
The Mariposa Clinic's medical telemedicine program has been regarded as one of the top programs in the country. And wherever we go, people are interested in knowing how it works in the setting of a community health center. And I might say it works because of the extraordinary nature of the community in Nogales, the very high level of talent both at the administrative level and with respect to the medical and nursing staffs and the support. The summary is it's been tremendously successful, and we couldn't be prouder of our relationship specifically with the Mariposa Clinic.
With an annual budget of $14 million and 200 employees, our health center has become a major employer in this community. While technology continues to change, what hasn't changed is the health center's commitment to everyone in our community.
Mariposa does so much outreach through so many different programs, and I think a lot of times the community is aware of the program, but they're not aware that it's part of Mariposa.
For example, diabetes is a life-threatening problem spreading rapidly throughout America's Hispanic community. Instead of waiting to only treat patients who come to us already with an advanced case of the disease, the health center has gone out into the community and launched a prevention program.
Porque están aquí para prevenir. ¿Prevenir qué? Complicaciones.
And all the programs that they offer, like on obesity, on heart disease, on diabetes, how they work with peers, to me it's been extremely impressive, and I think that in itself is a prevention tool and has been such a positive factor for the community.
Accessibility is the heart of our mission. You can have the best technology in the world, you can have the most well-trained staff and dedicated staff in the world, but if people can't get in the door because of economic barriers or geographic barriers or cultural barriers or those kinds of things, then you're really not able to make a difference in people's lives, and that's what we're about. I mean, we're about access to care. That's primary. But we're also about making a difference in people's lives. You can't do the second without the first.
Anybody see them when you're wearing them?
Just ask Amber. She knows all about how the Mariposa Community Health Center impacts lives. Today, her face lights up with a smile that shows confidence. But just a short time ago, this is what Amber's teeth looked like.
Sometimes when people would make fun of me, that would kind of hurt.
Her family simply couldn't afford the expensive braces and surgery. There are hundreds of children like Amber in our area, so the Mariposa Community Health Center chose to expand and include affordable orthodontics. The result, a life-changing event.
No, I can't stop smiling.
For patients like Amber and so many others, the community in Mariposa Community Health Center means more than buildings and equipment. It means people and families.
Me sentí inmediatamente todo aquello que llevaba yo de miedo, de inseguridad, me voy a morir siempre o no me voy a morir y esas cosas, ¿no? Empecé a entrar en una calma.
Sometimes patients come to see us for many reasons. Maybe because their blood pressure is high or they have diabetes. But in many instances, they need our help in other ways. And whatever that way is, we'd like to make a positive impact. And we're really committed to them, and we have shown that.
Healthcare is an extraordinarily complex business, but what drives us is, again, the dignity of our patients, the importance of what we do, and that our staff then have really come together with a kind of a collective caring that makes a difference.
Never a wish better than this, when you only got 100 years to live.
From those taking their first steps to those who have walked a lifetime, the Mariposa Community Health Center is here to help.
When you only got 100 years to live.
Para mí es mi clínica número 1.